COVID-19 has dealt a deleterious impact on our society, on our communities. We know from all of the economic data that our economies are suffering. But in addition to that, our people are also challenged at the emotional level, at the mental level. The facts are that many of us have now to be working in this remote environment. We have to be taking care of children while still focusing on the work related issues, the work related matters. Many are in their homes, unable to communicate as they would have in the past with people. And it is seemingly an even more stressful environment than prior to the start of this pandemic. And so we felt that it is important at this time for our business colleagues, our stakeholders, to focus on this issue. Want you, yes, to be able to manage your businesses and have successful enterprises. We know that capital is not the only issue. We know clearly that training and development of business plans are not the only issues, but that we need to have a focus on your mental health as well. And so today, I am pleased to introduce Dr. Ermine Belle as our guest speaker today. And Dr. Belle is a retired consultant psychiatrist who holds a Bachelor of Medicine, a Bachelor of Surgery, and a Doctor of Medicine in Psychiatry. During her career, she served as a psychiatrist at the Queen Elizabeth Hospital and the Psychiatric Hospital, working her way through the ranks until she attained the post of Senior Consultant Psychiatrist, a post she held from 1994 until 2015. Dr. Belle's work as a psychiatrist has given her the opportunity to give presentations both locally and internationally with entities such as the World Health Organization, the Pan American Health Organization, and the Commonwealth Secretariat, among others. Dr. Belle, now retired from public service, continues to serve the Barbadian public through a private psychiatric practice. I'm sure you will agree with me from that very short bio that our presenter today is very much skilled and competent to address this issue. And so without any further ado, ladies and gentlemen, it is my pleasure to introduce Dr. Ermine Belle to address for us today coping with mental health during COVID. Dr. Belle, good morning.
Good morning, and Madam CEO, Dr. Lynette Holder, I have the name correctly.
Yes,
I
yes,
do want to just first of all thank you and the members of your association for inviting me to be a part of this particular meeting and to share with you in the way that I will try to share today. Now, importantly, I know that you had a plan for a different day for your meeting and that you actually changed to accommodate me, which is even more flattering, I think. But thank you for having me. Thank you for having me on as well, all the members of your association who are here present, ladies and gentlemen. Without a doubt, the topic that you have decided to share, to have me share with you today is a very important one. And I want to say upfront that I think that it is the most important aspect right now of this pandemic. I might be really, because I'm in mental health, I might be being a bit, you know, overwhelming as far as mental health is concerned. But I do believe that very importantly, mental health has always to be included in everything that is done as far as health is concerned. Uh, so my topic today is coping with mental health during the COVID-19 pandemic. Now, what is very important about this situation is that we have sat here in Barbados and we have watched other countries. We have been seeing what has been happening all over the world and in some countries with worse results than others. We were made very early aware of all that was going on. We were constantly aware of the growing figures of COVID-19 and also the fact that there were deaths related to the illness and that the viral infection was spreading very rapidly globally. So our journey into the corona world was initially through information and seemed distant, and of course was not that frightening. It had a more academic term. But then all of a sudden, in the last how many months, there was a sudden burst. And I do think that even now, more than before, we have reached the point where mental health is a major issue. So, like everywhere else, we are reading daily about the happenings. We are hoping and praying that we were hoping and praying that it wouldn't reach us, but it has. The virus was new and unknown. And of course, the questions immediately would have been asked of where did it come from? Why was it spreading so rapidly? Why were so many people dying so fast? Was there treatment? Will it be eventually gotten rid of? And those are very pertinent questions. And initially, again, as I can say, we had a lot to be thankful for. We were looking on and seeing countries with greater wealth, medical expertise, better infrastructure, technology, research, capacity, all struggling to contain this deadly illness. By the time Barbados had recorded its first case in, I think it was March, I'm not even sure, 2020, we had already been, it had already, the illness had already been declared a pandemic. And not only was the condition declared a pandemic, but the facts about the disease were now fairly well known. So we were up to date with what was going on, even though we were not heavily in the struggle. Here in Barbados, we had had only 7 deaths for the first year of COVID-19 being present in Barbados. Many of us, however, by then knew persons who had died across the globe. Some had lost children, siblings, parents, partners, co-workers, lifelong friends, and neighbors and some patients. And I can assure you that I can remember very distinctly the first and the second person that I knew personally who had died of COVID in early in 2020, and they were both overseas. And so we have had to watch and share in the grief of others long distance. But 2021 has been very different. Our figures escalated dramatically from around 300 persons to over 2,000. I think today it is 2,791 or something like that. And we know that it is still climbing. So the grief is not distant now, the grief is on our shores. So why do we want to talk about mental health in the context of the pandemic? I remember very early on people saying that mental health was now becoming a pandemic in the pandemic. And I would like to contradict that because mental health is an integral part of the COVID-19 pandemic. It's not a pandemic in a pandemic, it's part of the pandemic, as it is a part of any disaster that, or any natural disaster that occurs in our situation, hurricanes, etc., etc. Mental health is always an issue in different degrees in all health matters. It is often ignored or avoided until it becomes a major problem, and we really don't want that to be the situation. Just to put in a plug further for mental health, there have been more, there's been more respect paid to mental health in the last 30 to 40 years, and thank God for that, because now we get on to issues a little bit faster. The reality and the effects of COVID-19 in Barbados are there. The impact has been great. And it has been, as I say, rather sudden in the last so many months. This disease has impacted persons throughout Barbados. The impact is on persons of all ages, irrespective of gender, ethnicity, religious beliefs, or socioeconomic state, or any other variables, really. It is no respect of persons. And there are certain populations, of course, which have been affected more than others, populations within our society. Of course, we have those that are infected with the virus, their family members, and we've heard over and over again about the trials and tribulations of the first responders and frontline workers, older adults, people with pre-existing conditions, adolescents, and young people. And that is a reasonably long list. Initially, again, we were not being involved in a big way, but now it is with us. All of the groups identified on that last slide are persons who have been undergoing added stress, worry, anxieties in their lives as a result of the COVID-19 pandemic. Let's look at them one by one. What if you were infected with COVID-19? Put yourself in that position. The first thing you know is that people die. You don't hear being reinforced, of course, that most of those affected have mild illnesses. It is human nature for us to hear the worst narrative in our heads, so we hear death. And therefore, the overwhelming reaction and emotion is fear. And this is what is happening in most societies across the world. Sorry about the coughing. That is my dry cough as opposed to COVID cough. Then come the thoughts about the future of those you will be leaving behind and their future and survival, especially if you're the breadwinner. You're the person earning for them, and suddenly you're out of commission. And you start worrying about what is going to happen to them, what support system will they have, etc., etc. Worst case scenario, you end up in quarantine away from your family, even if you're quarantined at home. You have to be away from them. I said worst case scenario, but if we are testing positive, we must go into isolation. These are words that scare you. Quarantine, isolation. And isolation has to be worse than quarantine. When we are put in an isolation center, we really don't have any contact with family or friends. Have to depend on those who are working with us and looking after us to be those friends and people that we can identify with. But when you're wearing PPPs, the personal protective gear, we all look alike. You can see our eyes, but you can't see much else. So we look like persons from outer space. You can make out no faces. There is minimal physical contact through the PPEs. Yes, they're bathing us and helping us to get on with our lives in the best way they can, but the physical contact is missing. And most of us thrive on physical contact. Then there are the other groups, the elderly and the high risk because of pre-existing conditions. What happens if I get this illness and I have to be isolated and I have a pre-existing condition? Will I get worse because of my heart disease, my hypertension or diabetes? You keep hearing about the chronic non-communicative diseases. And it is very important. It is very important to appreciate that these non-communicative diseases are a big part of the Barbadian life situation. We have a lifestyle which predisposes to these. And I would be asking myself, will I end up with a stroke? Will I end up with more chronic lung disease and then can't function? When I get over this COVID infection, what will be happening to me? Who will I call upon to help me? And so other emotions that we go through are loneliness, fear of abandonment, and in the elderly, there is a real risk of these two, fear and abandonment. We must also think of this other group, those in healthcare or long-term care. Many healthcare workers across the globe are suffering from anxiety and depression. Each day they have to wonder if they too will become infected. Each day they wonder if they're carrying infection home to their families. Some have opted even to isolate themselves from family members and have gone to live alone. So this is a new dimension because now they don't have the contact that they used to have before with the people they care about most. Every day they're suffering and seeing death. They're facing suffering and seeing death and grief. all of these people need psychological support. Very often they can't stop to think during the working hours because of the excessive workload. But when you get home and you're tired and overwhelmed, then the thoughts start in your head and the fears and worries come to the fore. This often results in insomnia, and over a prolonged period will result in burnout and may lead to the development of a more major psychiatric illness if these concerns are not addressed. Then there are children and adolescents and young people, in mental health. At one time, we used to have to be telling people children have feelings too. Children can become ill mentally as well. You have a child whose relative, a parent dies, and you hear people saying things like, oh, he'll get past that, she'll get past that. They have the same feelings that we do, and we have to accept that we have to address their issues just like we address the issues of adults. And this pandemic has brought it home very, very forcibly. Children are at home. Children are accustomed to being outside and out and about, even though in this technological age they tend to spend too much time on tablets and phones. But the fact is, they don't mind being out and about at times. They have their bicycles still. They have friends that they can run up and down the road with. They can play cricket. They can do all kinds of activities. And they go to school, which is even more vital. This pandemic has really, really stopped all of those activities. A lot of young people too, they have conditions, as I said, that predispose to mental illness. And just like the adults, if they're not looked after properly, when they start to worry and when they start to have extra stress because of the things that are happening or not happening in their lives, then their conditions worsen. And as I say at the top of this slide, is a recent study done in the UK in young people with pre-existing mental health conditions, in which 32% of those interviewed agreed that their conditions had worsened since the onset of COVID-19. So this is a reality. Many young people think that they are invincible, and this illness is about others and won't impact them. Of course, this makes it difficult for them to embrace the changes that have to come as a result of the pandemic. Maybe this is why we are seeing so many young people ending up before the courts, even though the protocols and the advisories are there about what they should do and what they should not do and how they should keep themselves at home and how they should not break curfews. Dealing with the younger generation and their loss of routine, closure of schools or universities and other places of higher learning, concerns about not seeing their friends, not being able to enjoy their sporting activities, being confined to home, etc. These are issues that have to be dealt with. We leave them alone, we are going to have to deal with the consequences. I just want a special group, and I did another presentation and I had this headed women, and some of the men in the group objected. So I changed it. I talk about pregnant mothers and new mothers and the worries they have about themselves and their newborn children when they are born, if they're pregnant during the pandemic, or the unborn child in relation to their health, the mother, when they're born and they have to be in situations where they're in contact with other people and they might spread this disease to their child. Of course, we do know that children seem not to get the illness as readily, and also that they do not necessarily get it as severely, even though we've had a recent case where we have had a very severe illness as a result of a COVID infection in a child ending up in death. And so this is a little bit on the scary side as well. And yet another recent study carried out in India, since the onset of COVID-19, 66% of women reported being increasingly stressed as opposed to 34% of men. They identified having children at home full time as a problem. But just last week, I had a call from a young gentleman, and he was the person who was at home with his children, and he was pulling out his hair because he had to manage the Zoom call, the school calls, the getting them online in time, getting them to take their breaks, getting them to do other things like their extra studies. His wife was the one who was working. So taking care of the family members as well as these extra things that are put on home caregivers is really very, very, very stressful. We've all heard about domestic violence and how it has been increasing. And of course, the increase is mentioned in the context of women again. But do believe me, some men also suffer domestic violence. And I think we had a recent maybe I don't know if it's adjudicated or if it has been dealt with, but a man saying that he had to leave a house because the woman was getting a little bit hostile. So he went to another woman's house as a result. Very interesting, because he was doing the wrong things in the curfew and he was going from one place to the other, but he was running from what he thought was a hostile situation with one woman. Going through these situations helps us to recognize better the degree of mental health issues we will and are continuing to encounter through the COVID-19 pandemic. We have to continue doing as we have been doing. The entire society has to be educated not only to physical health needs, but to mental health needs as well. If we include mental health in our management plans for COVID-19, we will set about making provision for the enhancing of coping skills in the society in general, and we will become equipped in handling the needs of special groups like the ones that I have mentioned. In doing so, you'll be able to alleviate the suffering and you will speed up the recovery and rebuilding of our communities when things are better. We must follow the protocols that we put in place to reduce spread. We must be creative in helping our children, adolescents, and young people to understand that this situation will improve, but things may never be quite the same again, at least not in the near future. So all of that sounds like just talk. So we have to learn to cope with stress, and this is vital. One of the things about coping with stress is that you often have to have people who can reassure you and help you to feel better. And so positive communication, giving advice on emotional well-being is very essential. And you know, you don't necessarily need a counselor or a doctor for that. You need a good friend. You need somebody that you can run your affairs by. You need somebody that you can tell anything about what you're going through. If you find that you're running out of your groceries, if you find that the children are getting under your skin, you have to be able to talk to somebody to get them to help you to get through that immediate problem, that immediate crisis, and then to find a way of dealing with it in the future. So, this emotional well-being is essential and positive communication can help it, and you need to rely on this. It must be constant, and the way in which people speak with you and help you has to be comprehensive, non-threatening, and give you an understanding of their give them an understanding of their anxieties and that their anxieties are well founded in some instances. Help others wherever possible by lending support and giving guidance where they can seek help and telling them where they can seek further help for their psychosocial needs, because that is a big part of the problem that we are going through. Messaging and communication about COVID-19. This has to be imparted to promote mental well-being. We can't only give negative messages, we must give some positive. And I think this is very important when we are feeding information about the data and about how many people are dying and things like that, because you can get some flooding and that can also help to put people in a very nervous state of mind. So you have to contain the undue flooding of information and particularly unvetted information from unreliable sources. And we are tired hearing about fake news now. It is something that happens. The internet and social media does not help. We have to be able to help people to sift through some of that information. And those of us who have that time or who have the knowledge of things that are going on from reliable sources, we should make sure to help people to concretize what they know that is positive and what is real. So, out of all of this, anxiety develops if the above situations are not handled efficiently. And anxiety is very easy to spread from one person to another. So, as I said, we have to reassure others that what is going on is going to pass. Uncertainty is a big threat to mental health. We have to try to stay positive. Remember, we are all in this together. We're not alone. This is worldwide, this is international. So there are many lessons to be learned from this coronavirus, COVID-19, SARS-2 experience. They're all one and the same. Change will happen, and we have to learn how to adjust and adapt. That is one of the biggest messages coming out of COVID-19. It is not business as usual. One of the things that we tend to do is to forget to say nice things to people sometimes, forget to be kind, forget to say Hi, I care about you, I love you. We must be kind and caring to each other because we don't know when the time will come that we will also need to reach out to each other. We just, we must adjust to the other normal, and people refer to it as the new normal. The knowledge gained during this whole pandemic experience has caused a serious shift in our everyday existence. Physical distancing. You know, this is one of the hardest changes that has come about. No hugging, no kissing, no touching. And from the very small child, the smallest child to the most elderly adult. We have a 111-year-old man in the paper today. Everybody has to learn that physical distancing is absolutely necessary. You have to wear your protective gear. You have to have your hygienic practices, and you have to stay at home whenever possible. You might say, but that doesn't relate to mental health, but it does. Because if you do the things that are right, you reduce the stress level. If you reduce the stress level, the anxiety is not overwhelming. If the anxiety is not overwhelming, you may not move on to other major conditions that could affect you. No health without mental health was a theme for World Mental Health Day many years ago. Let us be reminded of some of the mental health problems coming out of this pandemic. And as I've said, and I'll say again, there is worry leading to stress and anxiety, the possibility of stress and anxiety leading to depression, acting out behaviors, particularly in younger people, children, and adolescents. And then, of course, you may move on to other psychiatric disorders. Loneliness and isolation, loss, leading to sadness and grief, and ultimately to depression again and other major psychiatric disorders, is a reality in all, but very much more in those elderly persons, particularly those elderly persons whose children are far away from them, who are shut-ins, who are disabled, and of course that goes for the young disabled as well, because they are not probably going to get as much interaction from people who assist them as before. So these are serious considerations that we have to take into our heads and to deal with. So what do we have to do? As individuals, you, me, everybody, we have to admit to our fears. Because if we don't admit to our fears, we can't address them. And all of us do have fears. I am afraid that I will get ill. I'm afraid I will get ill because I have pre-existing conditions. I'm afraid because I'm over 70 and I hear that these people succumb more readily. I'm afraid because I am still the breadwinner and I can't look after my families if I get ill. I'm also afraid of death because I have not dealt with what death means. Spiritually, I am not in touch with my higher being that guides me and leads me into that area a little bit more significantly and easily. So we need to talk to the relevant persons about our fears and to deal with them. We need that support. We need to seek support in other areas. And luckily, lots of people have gotten care packages recently from governmental interventions. A lot of people can go to their neighbors and ask for help. There are individual bodies around the country who are willing to share and to give of what they have to other people who they know have less. We need support. We might be proud. Don't be afraid to say, I need help. Education, absolutely essential for your good mental health. If you don't know or understand something, you're going to worry much more and your anxieties will build. So you need to keep abreast of what is true. You need to keep abreast of what is correct as far as this condition is concerned. We don't need the fake news. We don't need the guesswork. We need the facts. Maintain some structure in your life. You know, I was one of those people, unfortunately or fortunately, in the first bit of shutdown of when it came last year, I was not unhappy because I can't think of a time in my life when I wasn't going. And suddenly I could stay home. And I didn't have to come home at 9 o'clock in the night because I wasn't going out to do anything. So I enjoyed it initially. And then I started realizing, but you're not being constructive. So I had to start factoring in some things to discipline myself to maintain some structure. And that I have had to continue as time has gone by. And I think that all of us have to realize that that structure helps us. It helps us to cope much better if we have something to put our minds to, something to take us away from the pandemic. The other thing, therefore, that goes along with that is discipline. So the things you used to do, the things that were necessary, you still need to maintain a way of doing them. You know, we are told as elderly people, speaking to the elderly now, don't go out. But you don't have to stop doing everything for yourself. You have to learn how to use the technology that is there. You have to learn to pay your bills online, for instance. And lots of us have had to do that. Relate to things that can help us to exist and function better. As I have here, we have to help others. You know, a lot of people don't realize the significance of sharing, the significance of doing for others, and the joy and the pleasure it can give you. So I'm just saying to you, if you can help somebody, you will help yourself. Be patient now, because we want the pandemic to go away. We want everything to go back to normal in a flash. It is not going to happen. This is something we have got to live with for a while and a while. So we have to be patient with ourselves. We have to be patient with the authorities and how they are managing the situation. We have to be patient with the virus because we can't really do a whole lot about it unless we follow the protocols, unless we do the things that are advised and the things that are right. So, all of that to say, we've got to go on functioning, we've got to go on living. We've got to learn new ways of doing things and dealing with this pandemic situation. So the tips go on. And up to, I'm missing a slide. Up to last night, I'll keep talking anyhow. Up to last night, I realized that there was an entity in Barbados that was saying, you know, that they're helping people to deal with being at home because they have a situation going for them where they're involving them in music, and involving them in exercise, they're involving them in looking after themselves properly. And this is very important because you are not with somebody, it does not mean that you cannot help them. And so this particular organization is busy helping people to look after themselves and to maintain some of the discipline and to maintain themselves and learn new skills as well. There are a lot of people I know who are baking and they never baked before. I know a lot of people who are learning a foreign language and they never learned a foreign language to any detail before. They're also looking at ways of doing other things and they are cleaning more because maybe a little bit paranoid, but they are cleaning. But it is helpful and it is useful and it will help them to maintain their places better in the future. So those are important things. Learn new things, learn new skills, involve yourself in activities, maintain relationships, because there are others whose relationships are not as strong as they should be, but you have the facility for maintaining those relationships in a way that years before we didn't, because you have things like this, the Zoom, you have the Skype, you have all of these uh, technological situations that help us to keep in touch and be able to see people and share with people on a regular basis. That is very important in this period when you cannot physically go to visit people at this point in time. Exercise, vital. I don't have to say much more about that. And this is one of the grouches that people have when there's a lockdown. But you're given some time to do it and you can exercise in your house. You just have to be creative. I remember once when somebody told me that she does 100 steps every morning. This is an elderly woman in her bathroom, and then she tries to see if she can go further and further and further every morning because she is not physically able to do much else, but she does her walking in her bathroom. Nothing wrong with that. These are things that you have to be imaginative and creative about. Your diet is essential. You have to maintain a proper diet because there's no good health if you don't have good physical health, and good physical health leads to good mental health as well. They are married to each other. So you're going to look at your diet as well and maintain a healthy diet as much as possible. Rest. I have had to speak to so many individuals because they are working from home and they're working online. And you know what they do? They work from 7 o'clock in the morning till 10 o'clock at night. Wrong. You have to give yourself that break. If you were working in a building in town, you would leave at 4:30 or 5 and you would go to the gym and you would go, even some people find it recreation wise to go into the supermarket and pick up 2 items, which you're advised now not to do. Don't go for 2 items. Go once and pick up everything and don't go back for another how long. But you get to do other things. You get involved in activities. You you relate to hobbies. These things do not have to stop. If you are somebody who likes to play a racquetball game, you can go and you can hit the ball against your wall once. Your old folk don't get upset by it. And if you dirty the wall, you clean it. But you can do your hitting against the wall with the racket, with the ball from the racket, if you so desire. You can do your singing. You can do other things that you like to do. You can maintain these and get yourself to feel good about yourself, even though you cannot actively participate in whatever activity it was that you used to participate in before. So I'm saying to you that it is very important that you take the time out to look after yourself physically. You take yourself time out to look after yourself mentally. And all in all, it is not necessary that you need tablets to quell your anxiety. You need to accept change and you need to adapt. The very next thing I'm going to say, which is vitally important, is that you have to listen to what people are saying that will help you to get past this situation. Now we are on the threshold of doing something very major because we have started having the vaccine in our country. And let me tell you, that is one of the biggest things to help you to maintain your mental health because you now know that you don't have to get sick. If you don't have to get sick, you can help somebody else who is ill better, or you can help them also not to get sick. So you do have to invest in getting your vaccination when the time is right, when you're advised to do it, and you try to do it so that you can maintain your good physical and your good mental health. I think that I've been talking for a little while, and I've tried to put in as much as possible of what I wanted to say. There's so many things that you can try. There's so many things you can do. And I know that I didn't spend a lot of time on your spiritual health, but you are somebody who is made up of different components. You have a physical being, you have a psychological being, and you have a spiritual being. I was telling somebody recently that I go to church more now, probably on Zoom on Sunday mornings than I used to when I had to dress and go down the road to church. And it is very uplifting and it is inspiring. So I am asking you to look after yourself holistically, but do not neglect your spiritual self and definitely do not neglect your mental health. I thank you.
Thank you very much, Dr. Bell, for sharing your perspectives with us. Very interesting presentation indeed. We're going to move to our question and answer segment now. So please let me remind you to post your questions, comments in the chat, and we'll go through them one by one. But before we do, Dr. Bella was particularly interested in the statistics coming out of India, where 66% of women and 34% of men reported having experienced increased stress as a result of COVID. I really wonder what the numbers would be for our Caribbean reality. But those numbers are high. 66% of women and 34% of men. And when you look at the makeup of their family structure, it's very similar to us in the Caribbean. We have to take care, yes, of our children. We have to take care of the elderly. You know, we have the extended family and so on. So those numbers, I will admit, really struck a chord for me. Pretty high.
Yes, and that's why I put them in there actually, because I felt, interestingly enough, that I could relate to it from what I see in my practice, that there are a lot of women and they come with the burdens of the household. There are a lot of one-parent households where the woman is the manager and the man is visiting as opposed to being present. And this is another aspect. And so I think that if we did a statistical intervention looking at that, we may find that definitely we are in a situation where we would get some similar statistics.
Yeah. Let's go to our chat section at this time. I'm seeing a comment here from Neil Gibbs. Neil Gibbs is saying to us that, you know, there seem to be a focus on the young and the elderly, but what about the middle aged? We are losing our livelihoods, he says, careers, dreams, goals, etc. And so the longer that this pandemic continues, it is going to have an even more adverse effect on the middle age. So, how do we really cope?
Well, the thing about it is I missed a little part of your statement actually. So I don't know if you could repeat it for
Sure,
me
I
because
can.
I was dealing with the controls here and the technology.
Not a problem. As I was saying, that Neil is suggesting to us that while there's a heavy focus on the youth, yes, and on the elderly, the fact is that the middle age demographic, we also have to, you know, pay attention to that group because they're losing their livelihoods, their careers, their dreams, their goals. And the longer that the pandemic goes on, the harder it is going to be for that age group to rebuild and recover. So how do the middle age really cope at this point in time?
Well, the fact of the matter is that, as I said, this change adaptation situation is very, very vital. And I have a different concept, I think, of middle age than you do. When you say middle age, you're thinking of which age group
But
really, truly.
I somehow feel that Neil is talking about my age group, those that might very well be between 45 and 60. You
Okay,
know, 45
because
and 60 tend to be that demographic.
yeah, because I think somehow, and maybe I'm not being fair, but I think you have done a lot more with your lives. You've achieved a lot more, and you've reached a point where you are almost plateauing in some instances. I am a lot more worried about the group below you. I'm a lot more worried about the ones who are now launching into careers. And I don't know if I'm being unfair or not to that other age group, but I think it's going to be so much easier for you to get back on track. And a lot of you, even though you're not going into work and doing things of that nature, you have your jobs, you have your steady income still. Now, the ones who really have lost that income, that is where the difficulty comes. If you are, for instance, as you say, a small business owner and you have to shut down, that is critical. And believe me, I would say the Lord has to help you as well as we have to help each other because that is really, really a very serious and critical situation for anybody and that age group, particularly because even to get employed by somebody else is going to be very hard when things get back on track. I think we have to start educating people now in a different way out of this situation because we have to start having people understand savings and putting aside things over time. Somebody was saying to me out of a discussion, a similar type discussion, that he was aware of somebody who at age 50 was able to retire because of the way in which they saved. And I had to say to them, well, I had no concept of that type of saving when I was that age. just didn't know how to do it. So we need to go back to the drawing board
Yeah.
and start educating people, not just in that age group, but from an earlier age. So when they get to that age group, they have enough in their background to help them to survive. Yes, that age group is going to be in trouble if they lose their business, if they lose their livelihood, and they have other people to take care of and to look after. Hopefully, some of them will have younger people who can help them in that situation. But at the same time, you have to learn how to look for other possibilities as well. It is hard. You might have to change your focus as far as what you do and how you do it. I don't know if that helps to answer the question because that's a
Right. So
real
you're of
biggie.
the view that the concern really is the younger generation and maybe the more elderly, but that middle group, if I can call it that, they have a cushion, they have support mechanisms that
And they
they can
have,
rely on a lot easier.
yeah, and some of them have the education so that they can actually change their way of dealing with situations like work and education and business and so because they have a background. But it is like those children who are coming out of school and waiting to go into university and waiting to get scholarships and waiting to suddenly, what are they waiting for? It's almost like there's nothing out there to go to. Nobody's doing anything. Nothing is open. We are just here at a loose end. And we have to be able to reach out to them and start helping them to refocus as well. Because it's that not that there's nothing for them to do, but they might not be able to follow their particular dream at this particular time.
Mhm. This question here is a good segue, I think, into the next topic. Question coming from my colleague at the Barbados Today newspaper. He's asking, should there be any concern of a likelihood of an increase in suicide or suicide attempts during the pandemic? And are you aware of people in Barbados indicating that they are unable to cope?
Very interestingly, in my practice, I have seen very little of it in the last year. Very little of people who were not willing to say, I got to change, I got to look at doing things differently, help me to deal with my children a little better. But there was positivity. Just in the last 2 weeks, and then today, this morning before this, I got two calls, and both of them, the people were saying, I'm not sure I want to go on. So I now have to address those. In both instances, those people were between the ages of 25 and 40. One was male, one was female, believe me.
Okay, because I understand the question very well, and it is a concern that I've had. I'm sure many on this call identify with that. We've seen two suicides in recent weeks. More and more persons are expressing depression um, and because oftentimes, and you mentioned it in your presentation, that emotional support
It's
is
not
not
there.
there. And I'm very concerned about that. We need to have that emotional support, persons that you can talk to. Yeah, I know that we're in a technological environment, but sometimes I think we ought to put down the technology really and relate to others, because we need that emotional support at this time.
And that is very true. And that is one of the reasons why I do advocate that if you're trying the interventions like the ones that I mentioned to keep your mind off of the whole thing and it's not working, then you have to reach out to your best friends, your counselor, your psychologist, your psychiatrist, your social worker, whoever is there to be able to listen and guide you through managing the situation better.
Yeah. But here's a question from Allison. She's asking, how do you help staff members who were scared to work out of a concern for themselves or because they have someone in a vulnerable position at home? Work must continue, but you want obviously to be, empathetic to their fears.
Yes, but you also have to allow them to know that we're not grinding into a halt. Because if you grind to a halt, what happens? the whole place just stops functioning, and the losses then will be of a different type. So I think that is important for that person who is in charge of their co-workers or their employees to really be well versed in what is happening. And if you have to neglect a business half day to have a seminar so that somebody who is able to impart that kind of information to people in a way that they will accept, because messengers are very important. And if you can't do it yourself, then you need a good messenger so that the people who you're trying to convert, if you can call it that, are able to understand why they still need to go on, why they still need to function, why they still need to work, and the reasons why this will help their families to cope better. They have to be made to embrace the protocols so that they don't fall by the wayside because they're scared because they didn't do something that they should have done in the workplace, and therefore they feel more vulnerable. They have to be able to follow those protocols. You must put on your mask. You must protect your nose, your mouth, and your eyes. You must wash your hands. You must put on protective gear if you're working in a specialized situation where you are a caregiver or you are somebody who is looking after others who are ill. These are realities that we have to face, and we can only do what we are able to do by reinforcing the best way to manage the situations in every individual.
Yeah, I particularly like your suggestion that what our firms may need to do in those situations is to look to incorporate some sort of coaching session in their work program, where you have employees that are scared, for whatever reason, justifiably even, that you can maybe engage a business coach and spend a half day in a seminar going through issues that can help reinforce the safety of the environment, the importance of following the protocols and so on, but also helping to address the um, emotional and mental issues that the employee may be faced with or may be confronted at that point in time. So to incorporate that in the business and in the schedule and the timetable of the business, I think is also a good idea. Beyond just the remote regime that we're accustomed to. But
And that is true.
here's a question from Julian. Julian is very impressed with the presentation so far, and he feels that there should be some focus on persons who suffer from anxiety and depression, and what coping mechanisms, he's asking, are there to deal with this? Because as you know, we have a lot of people who suffer from depression, but people don't know.
Right. And again, you see, it depends on the level of anxiety. It depends on the recognition of the differences between anxiety and depression. And of course, I always tell people you seldom have one without the other. And so, if the recognition is anxiety, and it is that you're going to a situation where you're not able to function because of the level of anxiousness that exists, then you really need professional help. I can talk you down over the phone at 2 o'clock in the morning. I can help you to relax as a friend. I can help you. I can say to you, go and get a cup of hot chocolate and drink it while you're talking to me, and let us see if we can get you to get some sleep. But when it reaches the level where I am talking and you are not hearing and all you're doing is panicking, you need professional help. And very often, when you're going for that professional help, it is identified that there is a degree of depression in place already. So, yes, I am not saying that everybody must rush to a psychiatrist, but I'm saying that you have to have somebody who can discern that level of anxiety and then decide whether you do need to go further in getting help or if you need to just learn how to do some relaxing exercises. And those are very helpful. The deep breathing and, counting to 25 or 30 or 45, whichever it is, whatever suits and resonates with you. Those are things you can do, yes. But when it becomes uncontrollable and you can't get the anxiety out of your mind and everything you do is compromised by your thoughts, you need professional help.
Mhm. Very good. Dr. Bell, you would agree with me that in the environment we're in Barbados, persons who have family members that were positive with COVID-19 are themselves suffering at this point in time with, the issue of stigma and discrimination and so on. And so Kathy's asking, um, how do you really address this? Where you have your family members within communities who've tested positive, but now there's stigma on your family. How do you cope?
And you know, this is why I have been very happy and very pleased with the approach that has been taken, that it is not who you are, it is not where you live, it is nothing like that that is important in managing this condition. What is important is to tackle the virus. And so education is really at the bottom of this. It's the key to the whole thing. You have to get
Mhm.
that fear, and as you say, lead into the stigma. You have to get that out of. That's what causes the stigma. It is those people out there who are fearful. They're not admitting to their fear, so they start apportioning blame and getting confused and wanting to close down areas of a country because somebody in that area, there's too much of COVID in that village. Nonsense. You have to be able to understand that it is not going to stay in that village anyhow. And that probably it didn't start in that village. It probably started in yours, but it just hasn't spread so fast. So you need to understand that this is not choosing any set of people and making them worse, or they're not getting it because they're devil's children and you're God's child. It is because the virus is going to go wherever it can go and attack whoever it can contact. So I hope that we will never reach the stage where people's names are being called. I hope we will never reach the stage where villages or roads or communities are being identified as being COVID villages. And I hope that people will continue to preach and to teach and to educate our people. I've been very happy, actually, for instance, with the persons who are out there in the community working, people in supermarkets. I take off my hat to them every single day. I take off my hat to everybody who is doing the people's business and keeping the country floating. Because they could decide to be fearful and stay home too. And then what will happen to the rest of us? The country wouldn't have to be closed down. It will close down. It will stop being a country. All of us will be just sitting at home staring at the walls. So we have to thank those people who have been persevering, who have been pushing through. And that's why it's so important for us to support them. It is very, very vital for us to support those people who have kept this country going up until now and
Yeah.
not to allow the stigma to overtake and to damage anybody else.
Mhm. I'm
I
hearing
don't know
that
if that
point coming out in your comments quite often. Support, support, support. That
is the
that
key.
support mechanism, that emotional support is needed for whatever the issue it is, the vulnerable groups within our society. Support. That is critical. I'm hearing that, and I'm supporting that we need to return to that time, as you recall, where we had that support in the family. I'm
Mhm.
I'm paying attention to what's going on around us. I'm not so sure, Dr. Bell, if you're realizing that this pandemic is challenging us to revert to some of the moorings that we were accustomed to, how we grew up. You remember that when we went to the supermarket as children, we had to walk with bags.
Mhm.
Now we have to take bags again,
That's right. Mhm.
and we had that emotional support in the extended family. We have, it would appear, to we resort to some of that again.
It might be what goes around comes around.
Well, there you
Because
go.
as you
Life,
said,
life,
we used to
life is a
go,
cycle.
we used to go with the paper bags. I know we're
Yeah,
going with the other bags that are a little stronger,
a
yes,
little
but we
stronger,
have to take our bag.
but we have
And
them to
but
take our bags back. Correct.
but we have to learn also to accept support, which is the other thing. And I myself, I was very interested in my response to support personally, because I am one of those independent people spent most of my life looking after me. And so, when suddenly somebody says, well, I'll do this for you, I'll do that for you, it's like, well, they think I'm an invalid or something. But it's
Yeah,
not that. It's that they care. It's
yeah.
that they want to be of assistance and they want to protect you. So don't let your ego get the better of you,
Right.
even in these situations.
All right, I have a question here from Keisha, and she's taking us back to the discussion around the youth and young persons who want to be involved in business and so on. And the critical point being made here is that yes, young people want to get involved in business, but obviously the COVID, you know, restrictions and so on, that they're preventing those young people from experiencing what it is like to be in business. So, what can we do to help them address the setbacks that they're facing right now?
Well, that is really a difficult question, especially for somebody like me who is not too business oriented. But you must understand that this is going to go away. I mean, years ago, we were afraid that MERS would reach our shores. We were afraid that SARS would reach our shores. We were afraid that Ebola would reach our shores. This one has reached us, but it is not necessarily going to stay forever. And it's not necessarily going to stay at the level that it is at forever. So even though you want to get your feet in there, you want to get them wet, you want to take off, just move a little bit more slowly and learn more. Because if you go into business today and you don't know a degree of A, you're gonna have to learn it. So learn it now so that later on you can use it right up front.
Yeah.
And I think that's the kind of approach that we need to have, that education never ever stops. In my situation, I never stop learning. And I know that in most situations, you can go on until you get to a level where life becomes so much easier if you have the tools at hand. So I would say to them, persevere. I would say to the people who are helping them, keep reinforcing to them that it is important to have all the skills and all the knowledge that you can have to do anything. That is what is important.
Right. Whereas I couldn't give them any advice on mental issues. I can say to them as a person interested in business, they can definitely contact the Small Business Association. We can
Very
get them
much
into
so.
our network and provide some support for them within our network. Here's a query from one of our colleagues from Trinidad and Tobago. They're asking, what advice do you have for mental health advocates or persons bringing awareness to these issues during these times? This is from Trinidad and Tobago.
Okay, very interestingly, I am a mental health advocate, but I also am very aware that there are people who can become over enthusiastic. They want to help, but don't go there and help unless you have the appropriate and accurate information. And I say that really very seriously and without any reservations, because I remember very sometime back, there was a program on the TV by a very noted female person, not in Barbados, overseas, like Oprah. And she was giving mental health advice. And I drove into a gas station after a particular program that was on that morning. And the gas attendant kept me there for about a half hour. He had met me before because he had come to the polyclinic where I was working at that time with mental health issues. And he said to me that that program depressed him so much because of the fact that it was a do good program. And it was not really able, after the half hour or 3/4 of an hour or whatever time it went on, it had not given him anything to work with. It had opened up the wound of what he had gone through, but it had not given him any ammunition to deal with it. So I think that we have to, as mental health advocates, not only want to do good, we're not do gooders. We are people who have information that is important, that has to be conveyed, that has to help people how to cope. We have to help them then to look for their coping skills. We can't give them coping skills. We have to help them examine themselves and their personalities so that they can work out for themselves the best way that they can cope. There's some people who can only do things when they have a crisis. There are other people who can learn to avoid a crisis. And there are other people who can put it on hold and say, I'll get back to it. So we have to be able, when we are advising and giving help and sharing and being advocate, to help people to understand you need to get to know yourself better. And we will hold your hand and walk with you. And we will give you advice and we will help you to look to see how you can work through your problems the best way you can. I don't know if
Yeah.
that answers the question.
I'm sure it did. Helping to cope.
Mhm.
That's what I'm hearing coming out. I have a few more. I know that we're past our time, but if you would permit me, I have at least another three comments here. One from Michelle. She's asking if if we have at this point in time any policies or initiatives that at the national level, that is, to focus on maintaining wellness during this time. As you know, there's always a stigma attached to mental health. So she wants to know what are the policies at the national level or initiatives at the national level that will help at this time.
Well, let's put it this way. I'm the wrong person to ask. I'm not a policymaker. Um, but there are basic things that I know that any government or any set of persons in mental health, in health and wellness would have to be looking at. And I know that they would want for the people who are trained in mental health to pull out the stops, to do what I was just saying that I would do. The policy has to be to tackle the problem before it gets worse. That has to be a major policy. So you don't wait for 10 suicides. You know that suicide can happen. So you're going to have something like a hotline that deals with people calling in saying that they're having problems and they need help, and you have to be able to direct them to the help. So there has to be something in there which says these are the places you can go, these are the people you can call, these are the institutions that are available, this is what we can do if you're suffering from such and such a problem. There have to be educational programs that should be going on, and I know that some of them are going on, where even if there are no crises, you are teaching people and you're opening their minds. This program is a program that is hopefully trying to help people to address mental health issues. It's not a governmental issue, but it feeds down from it. It feeds down from knowing that the powers that be want us to address mental health. So I think that there are so many different ways of approaching it and so many different avenues. And the
Yeah.
policies have to be asked for sometimes by us because we can point out to governmental personnel, this is what I know is happening, and therefore we need to look at it. We can help to make those policies.
Mhm. I quite agree. And actually, one of the initiatives that came to mind as you were going through your thoughts is that the COVID unit recently announced a special team uh, that of doctors, I assume psychiatrists and psychologists and so on, that will provide that support to persons, going through this pandemic who may have a need. And I think there's a hotline would have been announced that they can call for that support. So I know that that is one of the initiatives for sure by the COVID team to address issues of mental health at this time. So I believe that takes care of that question, and our colleague can Michelle can uh, call that unit and point anyone that she may know even to that unit to get assistance. But here's an interesting question from Julian Eiffel. Julian is saying that there are persons who play lotto and gamble on horses daily. They drink alcohol and smoke daily. And if they don't have access to these habits, Could there be withdrawal symptoms?
Mhm.
And, how to deal with those withdrawal symptoms?
That is hard too,
That's an interesting question
because
for Julian.
I remember years and years ago when I was working in the psychiatric hospital and I had a patient who was a gambler, who used to go in to a street in town morning, noon, and night and gamble. And a hurricane was coming. And her husband called me and he was frantic. She's not in her usual gambling pool. She's not where she usually is. I can't find her. Dr. Bell, what I can do, where we can go, what, you know. And I said, well, look, the only thing we can do is start calling all the gambling houses. And we found her. But the fact of the matter is, how you get her to stay in her house, hurricane or no hurricane? I mean, literally, he would have to sit down on her. That is not a reason for putting somebody in a hospital. It's not a reason for putting them in prison. It is a matter that you have to try to find some way to lock them in for that just time, maybe to set up to you and your partner, if you're is your partner, to play some cards or to do something that will give them a little bit of hint of what they're into. I'm not saying to you gamble, but I mean you can probably say, well, if you win this game, you can get so and so. I mean, but it is a way that has to be innovative and to suit that person's personality, and that is not easy. And the ones who drink alcohol in that way to keep their spirits literally going, um, the alcohol was bought up initially and taken home. And I'm sure it's still being bought up and taken home. But you still have to then control the drinking because, there is drinking too much and there is withdrawal because you're not getting enough. And both are bad. So it's not an easy situation to address at all. You don't want them getting in trouble with the police. You don't want them climbing out through a window to go to a rum shop that is closed and then breaking into the rum shop to get the rum and then getting caught by the police. And they got two charges: breaking COVID regulations and stealing.
Mhm. But those persons that suffer from um, such habits that they are unable to control, because that's the issue for me, the ability to control your habit. Shouldn't they then maybe seek some professional help if you're
If you
unable to control your habit?
if you can get them to, that is
Mm,
the problem with that kind of a habit because those of us who work in mental health know that you can carry the horse to the water, but you can't make it drink. So when
mm,
it comes to substance abuse, particularly, if you take somebody for help and they're not willing to accept the help, it's like butting your head against a wall.
yeah.
But you can try. But the time to move with somebody who has mental health issues of that type that are addictive is when they say, I want help. You don't hesitate. So if it's morning, noon, or night, then you need your COVID pass because you
Yeah.
have to get them somewhere for help. And it is a good enough reason for you to be on the road to get them some help.
Yeah. Very good. Well, Dr. Bell, thank you so much for sharing with us today. I want to recap your formula, if you will allow me to. You indicated that we should admit to our fears, seek support, educate ourselves, maintain structure, maintain discipline, help others, be patient, and to top it all, learn new ways of doing things. This is your formula that you've prescribed to us
And I'm
at this
afraid I
time.
had another slide after that, which didn't show. So I'm going to have to make sure to send it to you, which was the one talking about maintaining your physical health as well, your diet, your
Yes,
exercise, getting enough rest, and maintaining relationships. That is very key.
very important. And
Mm.
the physical health will for sure assist in our maintaining good mental and emotional health.
Right,
Thank you
because
so
there is
much.
no health without mental health and vice versa.